Good afternoon, class. Welcome to week 9 of ethics. This is the last week you will have lecture. The last two chapters that we will cover in ethics are chapter 24, which is nursing, policy, and politics, understanding the connection, the nurse's role in the policy process. And then we're going to cover chapter 25, which just regards professional nursing associations. So chapter 24, nursing policy and politics. So if you think about it, nurses have a strong historical roots in advocacy and action, which include identifying how to best distribute resources to individuals, families, and populations. Nurses are present at every level of the healthcare system and can identify potential solutions to health issues and be instrumental in implementing effective solutions. So, nurses are on the front line. We're on the front line of care delivery and have deep connections to our patients, the family members, and the communities. We are essential to ensuring that healthcare is consistently accessible, equitable, and of high quality. And we are present at every level of the healthcare systems and can identify those potential solutions to health issues and be instrumental in implementing effective solutions. So, nursing has been involved in policy and politics for a long time, probably a lot longer than we really think about how long they have been involved in it. But, in 2010, they passed the Patient Protection and Affordable Care Act. And the Affordable Care Act, the goals of that was to increase access to affordable care and holding insurance companies accountable to improve the consistency and scope of coverage. There's been a lot of different changes to the to the Affordable Care Act throughout the years. But, the thing that we have to remember is nurses still have a responsibility to advocate for healthcare as a basic human right and access to an affordable package of essential health services. What are health issues that present complex challenges? Opioid use that has increased across the United States, and increased incidence of suicide and depressions, especially in our young adults and veterans. Human trafficking as a social and health issue has been identified, and nurses and other health professionals have key roles in implementing screening and intervention. Infectious diseases. Think about the unexpected spread of the Zika virus as well as global warming. Think about what we're going through right now with the COVID-19. So nurses, there's healthcare issues that still are out there that present complex challenges. But it is essential for nurses to engage in policy development and be effective in working with other professionals or stakeholders to support access to healthcare, cost management, and quality improvement initiatives. On page 353, under Nursing and Policy, all aspects of the nursing profession are affected by policy issues, including safety and quality, healthcare standards, educational requirements, and nursing workforce conditions. So, and then in 2011, the Institute of Medicine and the Robert Wood Johnson Foundation, there was a report made that called for nurses to be better prepared with requisite competencies such as leadership, health policy, system improvements, research, evidence-based practice, and collaboration to deliver high-quality care, as well as competency in specific content areas, including population and community health and geriatrics. The 2011 IOM report also represented a turning point for the nursing profession and called for nurses to achieve higher levels of education and training to ensure delivery of safe, patient-centered care across all healthcare settings. There were 4 key recommendations in that report, which were the nurses should practice to the full extent of their education and training. Nurses should achieve higher levels of education and training through an improved education system and promote seamless academic progression. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. And effective workforce planning and policy making require better data collection and an improved infrastructure. On page 355, under defining politics and policy, it is essential to describe and differentiate the terms policy and politics and to clarify the relationship between them. The word policy is Greek in origin and is linked to citizenship. In government, policy involves the relationship of citizens to one another in public affairs, or as defined as a government plan of action to solve a problem. Public policy is a term that describes government actions. Policy is enacted through government systems, such as in the United States, where the 3 branches of the government are the legislative, executive, and judicial systems. These branches of the government have the authoritative capacity to make decisions or influence the actions, behaviors, or choices of others. Each branch of the government has a role in the formation and regulation of health policy. On page 356, underneath governmental policy. At the federal level, the U.S. Congress and the President make policy in 3 areas: the defense, domestic, and foreign. So, an example of this would be health-related defense policy includes a type of health care the military and their families will receive. Domestic policy refers to policies such as the enactment of the 2010 Affordable Care Act, which originally was planned to be a comprehensive law aimed at protecting consumers, increasing access to care, promoting health, improving the healthcare delivery system, and controlling cost. Health-related issues are integrated into foreign policy as well. Congress decides whether to assist other nations in preventing HIV/AIDS and providing family planning and nutrition assistance to developing countries, or responding to new health issues such as the 2016 Zika virus outbreak, which impacted global, regional, and military health policies. So remember, your defense policy includes the types of healthcare the military and their families will receive. Domestic policy refers to policies such as the enactment of the 2010 CARE Act. And then you have your foreign policies, which provide family planning and nutrition assistance to developing countries, responding to new health issues, or to assist other nations in preventing HIV or AIDS. Now remember, I want you to know the difference between the defense, domestic, and foreign policy. Also on page 356, policy involves the setting of goals and priorities by a society or an organization, and the decisions about how and what resources should be used to achieve these goals. Policies developed by nurses have frequently demonstrated a commitment to the value of assisting people to care for themselves despite their illness or disability, and this belief has distinguished nursing among other professions. Politics, the definition of politics, stems from the original Greek meaning, which referred to the government of the city-state, the actions of a government, politician, or political party. The process by which communities make decisions and govern, or the managing of a state or government. Politics involves power and influence for key decision making and requires significant investment in social capital. Politics is often defined as the process of who gets to decide how limited resources are allocated and distributed. In government, politics is an activity that is central to developing the policy that protects the well-being of society. So for nurses to be effective advocates for others and to shape policy and practice, it is necessary that they develop and practice political competence. This includes the ability to understand another's values and position and to use that insight to influence others to act. Nurses have expert knowledge in these practices because these practices are integral to the nursing process and are used to provide patient care. Page won't turn. And skills that are integral to the nursing practice provide a basis which nurses can apply in the arena of political advocacy and action. To function in the area of policy at all levels requires competencies which have not traditionally been adequately addressed in many nursing educational programs. And then the conceptualizing politics and policy development. We have Kingdon's 3 streams of policy development on the bottom of page 358. The problem stream includes what are defined as problems, indicators of a problem, and the social construction of problems. It also includes how problems come to the attention of policymakers, such as in the form of casual stories or personal experiences. And there is a little short little article right there on page 358 on the right side that you can read, and it talks about the current nursing faculty shortage and AACN's report on enrollment and graduations in baccalaureate and graduate nursing programs. Kingdon's second stream is the policy stream. That is where ideas that are potentially policy solutions are considered by their technical feasibility and value acceptability. The reality is that policymakers are presented with many problems, and it's impossible to address all of them. So policymakers are expected to set an agenda that reflects the values and issues on which to focus legislation or regulatory action. And then we have the political stream. And the significance of interest groups as part of the political stream cannot be overestimated. Interest groups provide politicians with one of 3 resources essential for their success. such as including re-election, including money, voter mobilization, and image. Image enhancement may be most significant for nurses regarding legislative interest. So having the support of nurses enhances a candidate's image. And in 2017, nurses ranked as among the most highly trusted professions in public opinion polls for 16 consecutive years. Nursing, you think about it, nursing is a profession of more than 3.2 million members nationally. When divided by 435 congressional districts nationally, there are approximately 5,000 RNs per congressional district who can and have mobilized voters. The power of the nursing numbers converts to votes that can make the difference in electing officials who support and endorse nursing's core values and positions. On page 360, analyzing policy making in professional nursing. A more traditional approach to analyzing policy making uses a systems-based model that considers policy making in sequential steps, much like the nursing process. Assess, plan, implement, evaluate, and assess again. In a policy system, a problem is identified and placed on the policy agenda, then developed, adopted, implemented, evaluated, and extended, modified, or terminated. The challenge of using traditional system model approach is that it fails to consider that the elected government's policy agenda rarely, if ever, reflect a consensus. So on page 361 under political advocacy, nurses who make things happen fall into three categories: professionals, leaders, and political change agents. All three groups vote in every election and stay informed regarding issues affecting the healthcare system. And they speak out about working conditions and quality of care. And let's see, what else do I want to cover in this chapter? On page 363, shaping policy begins with a nurse selecting and learning about the policy issues that are personally and professionally important enough for that nurse to become an active participant in the policy's activities. And one way to become engaged is through joining or supporting professional nursing organizations, which we will talk about in chapter 25. And finally, if you want to influence policy, you need to write your legislative representatives regarding any healthcare issues. Letters should always arrive before any proposed legislation is heard in committee because crucial decisions on proposed legislations are made in committee. So if you want, to influence a policy, write your legislative representatives regarding any healthcare issues. And then on page 364, 365, it lists a lot of the nursing leaders as policy pioneers. And their stories are similar. All of them shared a passion, courage, and perseverance. Also, they shared commitment to collective strengths. You have Lavina Dock. She organized Nurses for Social Awareness. Lillian Wald was the head public health and child welfare. She was one of the founders of public health and child welfare. Margaret Sanger, she was involved with birth control, and she brought about a policy change by first bringing the public and policymakers' attention to a compelling issue. So she finally got policy changed which occurred with the legislation of birth control. And Martha Minerva Franklin, she was involved with segregation and discrimination. So read through those. Those are pretty interesting. So, nurses at the forefront. What do we need to do at the forefront to make changes? Leaders in the early 20th centuries were involved in passing socially focused legislation that outlawed child labor, supported the suffrage movement, and protected women abandoned by their husbands. So, nursing was also in the forefront of and lent integrity to the civil rights movement. But as a result of the civil rights movement, poll taxes and literacy tests were made illegal. So, nurses were involved in a lot of policy changes. So if you, like I say, get involved, know who your legislation is. And on page 366, they talk about the 21st century nursing leaders of how nurses shape policies. Read through those, very interesting. But, you think about it, what would, in this day, now that we talk about our healthcare now, what would Lillian Wald do about healthcare coverage for children and access to healthcare? What would they do about racial health inequalities? What would Florence Nightingale do to elevate nursing in the policy debates? So, the question for today is, what should nursing do to change the policies? Because nurses can influence policies in the workplace and the community, both public and private. And the bottom line is nurses must grasp their responsibility to be active participants and remain involved to address the nation's course of declining health by advocating for better health for all. That is the end of chapter 24.